We heard there about the operation, and that's very fascinating about the details of what happened in theatre. But often one of the biggest challenges is what happens next, you know, the rehabilitation, the recovery as well. And what do you remember about that early period where you were perhaps heading home and the advice you were given and what came next?
Because I had my operation like in Stanmore, I had to go like under their umbrella as such and have my initial physio back at London. So it was a case of when I got discharged from, well, not discharged, when I came home from Stanmore initially, I came home as an outpatient and was told to rest for 4 weeks with my leg up on a, you know, on a poo for a coffee table, but I had to keep it elevated at all times. Yeah. That was because the blood functioning, getting the leg back to normal as such. And then after that period, I had to come back into Leicester Royal for some chemotherapy, but also on top of that, I was going back down to London to have physio as well. So it was, you know, it was a very, very intense time, busy time, and you know, very, very difficult time. Yeah.
Do you remember the advice you were given in terms of what you were allowed to do and not allowed to do?
Yes, I do. Yeah, I couldn't really do a great deal from being an active person and, you know, out and about all day and driving and enjoying life as such, and, you know, being open-minded to come into a, how can you say, like a cocoon really. Yes. where you can't get out of it because, you know, you've had this operation and, you know, I couldn't move forward, and you know, I'll be honest, it took a long time for me to get my head around that, but I did eventually, but yes. It's a very slow process.
We'll talk about that in a bit more detail in a second, but just in terms of the leg and what the effect was on your capability to get about, I imagine with the extent of the soft tissue involvement, you know, the operation, that there was quite, you know, a lot of weakness there or immobility in the leg.
There was, yes.
Can you describe what the situation was?
Yeah, it was very difficult to get around the house. You know, I was on crutches, but I was also in a bit of pain at that time. I was, you know, on morphine to get rid of the pain, but I was reliant on other people as such. You know, if I went out to hospital, you know, if I had to come to Leicester or, you know, down to London, I was reliant on, you know, friends to bring me, or, you know, the WRVS were very good with their service. They were excellent. So I had to use that, you know, and I can remember there was one day like I had to come down to London for an outpatient appointment about 2 months after I'd had my operation, and I had to have an ambulance to take me to London. Yeah. And EMAS, you know, they were very good, and, you know, they took me down to London in the back of an ambulance. Me and my wife, and, you know, with an ambulance driver, went all the way down the M1 with my leg up in the air. Yeah. In the back of an ambulance, but you know, and then wheeled me into there and brought me home safely. Yeah. Well, it just shows you how severe things were for you, even in that early recovery period. Yes, they were, yeah. Did it ever get frustrating that you were being held back? I know you were improving, but obviously you had that setback. Or were you looking at it more positively, like, well, they've treated the cancer and therefore it gets better from here? When they took away the tumour, like I was told that there was only one thing to worry about with a sarcoma in my case. If it ever came back as a cancer, it would attack my lungs. So they said that, you know, I've got to come back into Leicester every 3 months and have an X-ray on my chest. As a checkup? You know, as a checkup, which I am doing. But it did restrict me from doing an awful lot. You know, when you haven't got your legs and you can't get around, I couldn't drive. Yes. You know, I didn't drive for 3 months after the operation, you know, and I'm rarely, got outside. And that was part of your career, wasn't it, driving? Part of my career was driving. I used to love driving. I was up and down, the roads of the Midlands all the time. Yeah. So it must have been odd, just being limited to staying at home for so much. Most definitely. Most definitely. My wife took 7 weeks off work after the operation to look after me. Yeah. You know, she was a rock, to be honest with you. Without my wife, I wouldn't have. What else helped with the rehabilitation process? That is the process of trying to get back your function as much as you can. I did exactly what I was told. I didn't do anything out of what I was told. When I was told to do something, I'd do it. You know, if I was told to bend my leg or try and bend my leg, I'd do it. If I was told to rest it, I'd do it. I've done everything that the physios have told me to do.
Yes. You kept to their exact instructions.
I've kept their exact instructions, you know, both at home and in hospital.
So you had physio. I mean, roughly how much, for how long, how many weeks or months of physio?
I've had nearly 10 months of physio now.
Right.
After, since the operation.
So very intensive physiotherapy. Did you have any other input from allied health professionals? Occupational therapy, for example?
Yes, I've had that down in London and Stanmore.
What did they do for you? Do you remember?
Well, after the chemotherapy, I lost all sensations in my fingers.
Yeah.
And in my feet, in my toes. My fingers have come back. My toes haven't, unfortunately. My feet, feel cold all the time. But OT really worked on that, and they give me lots of things to do. Put my hands in a bowl of sand, or have a ball in my hands and keep squeezing it, which I did, and that's come back.
Yes.
That's fine.
Do you think that's partly a testament to that rehabilitation?
Yes, yes, most definitely, yes.
Yeah, that's good. I hadn't heard those tips before. I like what you're saying there.
Yeah.
We could use that for other patients.
Yeah.
So you had physio, OT, anything on the emotional, psychological or supportive side?
From an emotional side, I used to get, really upset in my head, because it put me back from what I really wanted to do in life. Everybody's got, plans, what they want to do, and, holidays, and, you want to do this with your home and all that. And we both had, certain things we wanted to do. We wanted to go to America on holiday, and which, we've not been able to do at this moment in time. But yes, me head really went in the, in the clouds, as they say, to be honest. But I had help from my local GP then, and I had to go on to antidepressants. I'm still on antidepressants, actually. 12 months later, and I found them very, very helpful, because you can really get down.
Yeah.